Okay. Good evening, everyone. Welcome to tonight's public consultation. And we'll start off first with a prayer, which will be said by Bernadine Collins, Chambers. Yep.
Let's pray. Let's bow our heads. We thank you, Lord, for the blessings of today and for bringing us here safely to this meeting. We are here because we are concerned about all the persons on island. We are happy for the opportunity that we can contribute our ideas and our thoughts to this policy. Bless those who are leading, and may, as we give suggestion this evening, may our thoughts be overshadowed by the needs and concerns of elderly, so that as a people we can all do what we can to enhance their lives. May this meeting be a success, and in the end, eventually, we will have completed and have a policy to guide us here in Montserrat on the care of older persons. Thank you for this opportunity, and be with us through the working of your Holy Spirit. In Jesus' name, amen and amen.
Okay. Thank you very much, Mrs. Collins, Chambers. My name is Barbara Bass, and I'm the Senior Social Worker for the Adults team. And with me, we have Dr. Sinclair Coward, the Social Work Mentor, who will be delivering the national policy. Yeah. All right. Tonight we'll be discussing about the policy, what we want to achieve, the background of the policy, the overview and main points, questions and comments, and at the end of it, we'd like you to contribute your questions and give your comments and give your feedback on the policy. Yes? Okay. We'll start off with first the purpose of the public consultation and what we want to achieve. The purpose of the public consultation, it provides the government of Montserrat with information. It enables people to participate in decision making and have a sense of ownership of the policy. It's a good way to assess the impact of the policy on the older people who it will affect and identify any unintended effects. Remember, nothing is yet entered into law, and so we can still make changes according to your views. The purpose of the national policy. The purpose of the national policy, it speaks to the position of the government of Montserrat that the government of Montserrat has on the care of its older population. It establishes the institutional framework necessary to safeguard rights and provide legal protection for well-being of older persons. It examines the situation of older persons in Montserrat and set plans to address those areas that hinder their full participation in Montserratian society. Why do we need this policy? The Montserrat population is aging, and its advanced age is linked to chronic diseases such as NCDs, that's non-communicable diseases, such as strokes, diabetes, hypertension, etc., disabilities, and dementia. Some older persons are financially well provided for in their old age. For others will suffer economic insecurity, poor health, inadequate housing, and a poorer quality of life. Pensions expenditure outstrips the income and this needs urgent attention. Social assistance benefits are low and need reviewing for its effectiveness and sustainability. The law does not specifically target older people in key areas. Lack of planning for retirement. The scope of national policy. Who is it aimed at? Policymakers, citizens, and all those affected or who have an effect on the issues raised. Legal standing. Policy is not law, but can lead to new laws. A policy is framed to achieve certain short, medium, and long-term goals. It is a written social contract or agreement. It defines the goals of Government of Montserrat in this regard and provides guidance as to how to achieve objectives. The background of the 2017 consultation. There was a consultation in 2017 between key stakeholders and the public. The consultation event in 2017 that says that it captured opinions from older persons, carers, the general public, and private services that support older persons about their vision for an older persons policy on Montserrat. The consultation forms an important bedrock on the current draft of the national policy. Summary of views from 2017 consultation. Older persons should be entitled to fees waiver and reduced fees for certain services. Those aged 60 to 65 years should receive concessions, and those who are 65 and above should be able to access certain services without charge. There needs legislation to protect rights. Older people feel ignored, powerless, and neglected. They need a voice in society. Montserrat needs a day center for older persons in the community to reduce isolation, increase socialization, and provide respite for carers. Social security payments needs raising. Pensions are perceived as inadequate and unfair. Pensions from abroad needs to receive percentage increases as appropriate. Financial stability in later life. Older persons often live from hand to mouth, so they were not in a position to save money. Grocery costs are expensive. Many older people cut back on their shopping, which could impact their nutritional intake. Healthy eating also avoids the onset of most medical conditions. Older people need transportation to get to medical appointments or go shopping. It is important for such transportation to be wheelchair accessible. Older persons may not be able to afford water connections and supply. MUL should consider reducing or waiving costs for elders. Physical planning should take account of persons with mobility issues, wheelchair accessible entrances, toilets, waiting areas, interview rooms, housing, transport, etc. Need for an occupational therapist. And we have a couple of underlying principles. The equity, equal treatment. Independence is around self-determination. Safety could be around commitment commitment to safety and security. Security could mean making the environment safe, productive aging, emphasis on positive aspects of aging. Home care, promote independent living, dignity. Older persons deserve to be treated with dignity. Human rights, respect those. Healthy lifestyle, promote these. Accessible, affordable, and supportive and sustainable policy objectives to be based on these. And now we'll go into the national policy and give an overview of this, which Dr. Coward will lead us on.
Thank you, Barbara. Thank you all, and good evening, and thank you all for coming out. As you know, this is a public consultation, so most of this tonight I want to be a conversation between you and us. Obviously, you need to know what's in the policy, so we're going to do our best to summarize what's in it, and then hopefully towards the end we get into a conversation. You let us know what you think about the policy thus far. Don't forget, it's a draft, it's a 10th draft, but it could be tightened. Looking at it myself after the 10th draft, I see areas where we could tweak it. And okay, so hopefully we'll get into that later on. This is the 4th of 4 public consultations. We've got 2 more after that. And hopefully people who are listening or looking online also would send in their views about what they think about the policy thus far. So you see the slide up there? First of all, it gives you an idea about the structure of the policy itself, and this is it. It's a slim volume. It's made up of about 50 pages. It contains background information on Montserrat. It contains data and statistics as up to date as far as possible. Not everything is quite up to date as we would have liked, but as far as possible on the current situation in Montserrat regarding non-communicable diseases, regarding the population, regarding education and other key stats on Montserrat. So that forms part of the introduction, if you would like, within the national policy. As a result of a number of consultations, and don't forget, this all began in 2008, would you believe, up to now, 2021. So it's gone through a number of different versions. Taking into account all of those versions, what we've done, we've whittled and all the information we've received down to 6 priorities. Previously, we had about 19 priorities there, but that was unwieldy, and that was, you know, it would be hard for the government of Montserrat to meet those within the time frame. And don't forget, the time frame is 2022 to 2026. It's only a short time frame, unlike the Sustainable Development Goals, I think, which stretch about 15, 20 years. So we've got 4 years. So that means we must be tight, we must be realistic in these objectives that we set. So we've set 6 of them, and the 6 are those that you can see up on the screen there. And so we have infrastructure, national infrastructure. That's to do with the roads, the buildings, transportation, that kind of thing. We have healthcare. You would expect that in a policy on older people. We have the social environment. That's mainly about interaction between people and social groups in society that has a big effect on the well-being of older people as the national infrastructure. So the national infrastructure and the social environment are very complementary and important in their own right. We touched on legislation. We thought that was important. A number of issues to do with older persons. We may need some underpinning legislation to make sure it happens. Okay, but we'll touch on that, and you may have a view on that when we come to it. Research, in terms of we need reliable information on which to base policy. So some of that information is missing. There's gaps in the quality of life for older people in Montserrat today, and we need to know what's going on, basically. And economic security in terms of income. and whether older people have enough income to live on. And within that, we come to pensions, we come to social welfare, etc. So let's put a bit of meat on those bones. So I'm going to go through each one of these national priorities and unpick them so that we can have a discussion at the end. I didn't ask how many of you have read the actual policy. It would be good. Oh, excellent. So a few people have made the effort, so you will have come forearmed, as it were. So you'll be ready to join the discussion from an informed perspective, and that's great. All right, so the national infrastructure, we have 7 objectives for that. The first objective, as you can see, where we're talking about establishing a housing commission, what we're going for there is the creation of a body. We want a creation of a body to audit the condition of accommodation that older people live in at the moment. And that's whether it's private, whether it's government, whether it's residential. We want to know the quality of the housing. Is it fit for purpose? What are we looking at in terms of expenditure to bring housing and accommodation up to an acceptable standard? In order to get that information, we've put down here that we need the creation of a body to audit that. So basically, that's just so that we can get a baseline on which to base policy and decisions. So that was the first objective from the national infrastructure. The second objective, we said, in terms of accessibility, now that's a big one. You would have your views on that. We're talking, in essence, about accessibility to public spaces and public buildings for older people and people with disabilities. There's organisations I know who have been very vocal on this in the last few years and who've had some successes. But still we know public buildings, beaches, toilets, the availability of them, are they accessible to all? Are they accessible, not just older people, but disabled people also? So we would like to see an increase in that accessibility within the next 4 years. In terms of the third objective, we want government and Montserrat to look at the public transportation for safety and accessibility. At the moment, I believe all the buses in Montserrat are privately owned. So we wondered whether there's scope for perhaps the government to introduce a government-run bus or buses service which caters for wheelchair, which caters for a low-level access, which may have a tailgate at the end of the gate, which can accommodate a Zimmer frame, which can accommodate people with crutches, etc. Because sometimes, at the moment, it's quite dangerous for a number of people to get on those buses. And we believe that some people may be ruling out going to certain places because they have to take the bus. And the same goes when we talk about national infrastructure for the pavements and sidewalks in Montserrat. I understand that years ago there was an effort to correct that so that people could move from A to B without fear of getting knocked over. Because at the moment, as you know, you try to go anywhere and you have to watch out for traffic. And that's if you're able-bodied. So if you have a condition or you're of age or you're quite frail or vulnerable, imagine how much more frightening a trip from A to B would be. Again, that would put people off going to where they need to go. On a radio call-in recently, somebody called in and said that that can actually affect people exercising their constitutional right to get access to people. He gave an example of going up the stairs to see the premiere, that he couldn't get up there, so he didn't go. Those kind of things. So we need to look at that. I know I haven't seen a lift in Montserrat, someone can correct me. I know there's a lot of expenditure when you talk about, you're very scared of lifts. But indeed, but could that be put on the agenda? Don't forget, all these are proposals. This is what we're talking about to improve the quality of life of older people in Montserrat. Also, are the buses free of charge? Is there a reduction for older people? Do we need to bring in a reduction for old? Now, we haven't defined any age for old, but I'm sure it's not beyond our ken to come up with one. If we're talking about in the national policy, that pertains to people 65 years and over, just to be in line with the retirement age. But we could say, for example, 75 or 80 is old, so all of their public services and all of their services could be free of charge once you reach that old stage, and a reduced charge for the younger ones between 60 and 75 and 80. Why not? Let's start a conversation about that. Okay. So number 5, safety and security at home. What we're talking about, I mean, Montserrat is fairly safe, very safe. Probably not as safe as it used to be. People always say that half of Montserrat is non-Montserratians. I don't know whether they're implying, but their point is that you can't rely on the old taken for granted way of living, that you can leave your door open and leave your car because you know everybody. That's not the case. So safety and security are issues for older persons. What about their doors, their windows? What about safety approaching the house in terms of steps? What about safety inside the house in terms of hazards within the house? A lot of accidents and falls happen for older people and disabled people inside the home, in the getting in and out the shower, in and out the bath, or hazards in the kitchen. What about that in terms of making it safe for older people to go about their business? And safety and security, we can bring in aspects of telecare there in terms of why not use the technology that's out there that's designed to keep people safe at home. Especially if you're in advancing years, you may have, the memory may not be as sharp, you may have the early stages of dementia perhaps, and rather than the first point of call is looking to put you in a residential home, what about looking to try and make you a little bit more safer at home with the adoption of some of these telecare devices that can perhaps alert others, alert neighbor, alert family, if you fall, if the cooker's been left on, or if you leave the house for a certain amount of time and you're not returned. All of these things can help you to stay independent in your own home rather than go elsewhere. So number 6 is independence for as long as possible. And I guess we strive for all older people to stay within their home for as long as they can. And here we need to invoke the name of carers, really, because carers can do a lot to help people stay at home. We're going to talk about people who are suffering from chronic illness and diseases in a minute in terms of what they need, but carers are important. Do we have adequate carers on Montserrat? Do they have sufficient training in order to do a professional job? Is there a body that regulates these carers and can guarantee or provide a check on the quality of work that they do? Is there a body that perhaps they need to be registered to in order to protect the people they're looking after from abuse, etc.? All of this needs looking at, warrants looking at, and this is what this proposal advocates, basically. And when it comes to residential, if the needs of an older person exceeds the ability of the carers to look after them, for example, do we have sufficient beds in the in Golden Years, in Magotson? Is the transfer from home to those residential facilities, is that smooth, or are there some barriers there that may prevent people going in there? Do we know, in terms of projections, because of the growing numbers of older people in society, we can perhaps project how many beds we will need in those facilities in the future? Are we doing that? Is that something we should get into so that we can set aside money, because we know in 5 or 10 years' time this amount of people will probably be looking for a bed in one of those residential? Or do we wait until that time comes and we say there's no room? So research comes into this also, so that we know what we're facing as we move forward. I think that, yes, that was the last one on the national infrastructure. So in terms of you feeding back to us, at the end we're going to have a discussion in terms of what you think about those things I've said, and we're going to capture it. I didn't tell you at the beginning, we've got a scribe somewhere over there who's going to jot down everything you say, and so that we can put it together and form another draft of the national policy. All right, so that national infrastructure was the first priority. The second priority, which as you could imagine would need to be in here, is health and social care. Now we've come up with 12 objectives under this health and safety in health and care. The first one is about rehabilitation with people suffering from a chronic illness, for stroke. Recently, there's been almost an epidemic. I know epidemic's not the right word when you talk about stroke, but there's been a lot of stroke victims in Montserrat. And are they happy? So people who have real experience of suffering serious illness, are they happy with the treatment they receive? Are they happy with plans made to transition them from hospital to home? Are they satisfied with the provision, perhaps, of carers for them, for the provision of aids and adaptations to their home in order to make it safe? These kind of things. Are they happy with therapists, aftercare, where patients may need speech therapy, where they may need physiotherapy, where they may need physical therapy, occupational therapy? Are they available? I know that there's more nuance to some of these provisions because you wouldn't want to employ some of these specialists on an island because of the reduced population and have them sitting down twiddling their thumbs. So, but there must be creative ways that we can get access to some of these specialists on island to meet the need of the people who are suffering these chronic illnesses. And what about equipment such as commodes and wheelchairs, etc.? What about adapting homes for wheelchairs, putting in slopes and accessible showers and shower chairs? All these equipments, they cost. And are they provided? Do we have enough to provide for people who need them? That's the big thing. I know there's some organizations out there. We got some reps regarding those organizations here who would have a view on whether they have enough resources to meet the needs in regards to this demand, and how much more, or what government should do what government should do to support them. So all of that is in terms of rehabilitative care for people who have long-term chronic illness and disease. So what about training? Training for staff in residential facilities and private homes. That's an important. I mentioned care earlier, but these carers who we're talking about, do they go through a program of training? Are they safe to go into people's homes and give them intimate care? What safeguards do we have in relations to the carers that we have? What training do they go through or are required to go through continuously? We talk about healthy aging to be promoted in the society. Healthy aging is about having good physical, good mental health and maintaining that. We know there's a cognitive decline as you get older, and you would expect that. But then you have beyond that, where you go into the dementias, etc. But healthy aging here and promoting that is about education, it's about diet, it's about weight, it's about controlling your drinking perhaps, and the other habits that you may get into that can lead to those chronic disabilities. And so we must take, or we're proposing that not only government but NGOs and other organizations take a more proactive role in campaigns and promotional exercises and education for people to basically look after themselves. Number 4, support respite and home care as an alternative to residential. The cost of a person going into residential care far outweighs the cost of providing carers to keep them at home by a big factor. Therefore, you would think it would be more prudent to push money into the carers, recruitment and training of carers. So we're advocating for more resources to be pushed towards the carer side of care rather than any other side of care. We're looking for carers and their training to be vastly and significantly increased in the community. At the same time, as I mentioned earlier, we have adequate beds for those who need it in the residential homes. The next one, I think, talks to regulating these residential homes. I know we have people here representing the homes, but what I'm talking about here is regulating them and developing some kind of quality standards for that home which they may be inspected against. Now, that not only protects the residents in that home, but it also reassures relatives. It also reassures relatives who may not be on island that the place where their older person is going has been assessed and has been inspected, and it's been approved as given a good quality standard of care to people. At the moment, I'm not sure what happens. I know elsewhere you may have some kind equivalent to a care quality commission that's in the UK that does this, but even then we still get a number of incidents and abuses in the home. So where there's no oversight at all, perhaps we need to look at that to see that we would need one in order to reassure people that their older persons are being looked after to a particular standard. What say you about that? So these are proposals, don't forget. All right, so we're talking about self-care, I think. It's one of our next proposals, and that dovetails with what we said earlier in terms of people taking care of themselves, in terms of prevention rather than cure. And this is where we talked about diet and exercise, regular checks, and about education and public campaigns. We're talking about providing psychological and psychiatric services to older people. Do they get access to that in the sufficiently that they need? Is there a form of ageism in terms of younger people seem to get access to those services? We only have one clinical psychologist on island that I know, but if you're an older person and you are suffering from depression, perhaps, how likely is it that you would get referred for professional help? So here we may need to find, we talk about research to find out what the need is and then measure it against the provision. We may need some of that in that area also. Okay, telecare is an issue that I know may be on the agenda for government ministers. They've talked about that before. Some kind of in-home monitoring system where we can monitor people for chronic diseases. In a sense, that's old tech, where you can have a bracelet on your ankle or on your wrist, which sends messages to a clinic or your GP or somewhere, which just monitors your health so you don't have to attend to the clinics as regular. So it's about some kind of in-home monitoring, and you can use telecare for that. You can use it to keep you safe. So in essence, we're saying let's get into the 21st century and let's try and get some of these technologies, which are relatively inexpensive. They're quite old tech. They've been around for 20 years or so, but we don't see much evidence of them in Montserrat, so why not? Let's bring them in. When we talk about primary and secondary health care, given the increasing numbers of older people in the community, given our aim to keep more people at home, that would then put the emphasis on primary care, primary health care. And so, is primary health care, as it's currently configured, adequate to meet the needs of people, the older age-range people in Montserrat? And is it, if it is, will it still be in 5 and 10 years' time? We don't forget we're talking about the future projected. We're taking a baseline now, but we know that the population is aging. What do we have to do about that in terms of primary health care delivery? Is it good still to have health clinics based in different areas around Montserrat? Are there enough of them? We have a district nurse, I think, who goes around to people in those communities. Is she enough? You tell me. You tell me, how can we improve that? In terms of secondary health care, we have the hospital. We know plans are moving through to upgrade and update, rebuild that hospital. So those plans are going on afoot. So hopefully, you know, the hospital is eagerly anticipated, and hopefully that will take care of some of the issues in terms of secondary health care. But in primary health care, have we got it right? Have we got it right at the moment? Promote public awareness programs in terms of the dementias and Alzheimer's disease. We did start that. I'm not sure where that went. Social services and the clinical psychologists combined and drew up a number of posters to giving people tips on what to do if they suspect an older person may be suffering from the beginnings of the Alzheimer's dementia. I haven't seen much of those posters recently, but we need probably to revisit that. We need to have a large campaign in terms of recognizing, in terms of what to do, in terms of helping family members to cope with people who may be succumbing to the dementias, and make that a public health campaign. So that was one of the proposals that we have here in terms of health and healthcare. So the social environment, that's about social connections, participation of people in civic life, and combating exclusion and isolation that older people can suffer as you get old and people leave or people die around you. So what do you do if you suspect a relative may be So how can we best make the social environment conducive to good health and bring down the risk of mental ill health? Because if you are isolated, if you are living alone, if you are socially excluded, if you rely on other people, the chances of mental ill health rise, the chances of physical poor health rise, and so it will be, and you have a higher risk of disease. So there's an interest in us in terms of connecting people, identifying people in a community who may be in that position and connecting them with others. Here, in terms of social, you can start with social groups. It doesn't have to be the government, it can be NGOs. This is where they can come in and they can play their part. We can, Barbara mentioned in 2017, the consultation, the idea of day centers for older people came up. I don't know of one, but I know one at Lookout in terms of the Evergreen Club, but that's in Lookout. And so if you live in Salem, you're not going to be able to get there for that group. Do we need more of those groups so we get older people out of their home together with other older people to do meaningful daytime activities, perhaps learn a skill, learn a trade, why not, and keep your mind active? This is all about the social environment. This is all about connecting people with each other, reducing isolation and exclusion. At the same time, you can teach and introduce new technologies to older persons. We had the Older Persons Month recently where Digicel gave some phones away. We had discussions saying how important learning the new technologies is to older people. We can't afford to leave them behind. That in terms of smartphones and smart tech, we should be doing what we can to make sure everybody is educated and up to speed on that. And in fact, that older people can use those skills to make money. Why not? To start business. This is the kind of thing that's accessible from your home. Now that we have this fiber optic, why not join the dots and teach and train people in order to help themselves and sustain themselves and keep their mind active as we go forward. Also, older people would stay in contact with their family at home and abroad through smartphones, etc. Can get access to funerals or weddings of loved ones here, near and far. So it's important to their quality of life and their mental well-being that older people be introduced to the wonders of new technology and what it can do, Let me take our action on elder abuse. Action on elder abuse. We're not sure in terms of the statistics on how many older people get abused, but as your mental acuity declines, you then become more and more vulnerable to the attentions of others who may want to separate you from what you have earned or collected throughout your life. And so we're saying that older people may need protection from that kind of attention. So this is where the social environment and legislation overlaps, because there's two specific pieces of legislation that we feel should be introduced to protect older people and disabled people for that matter. One of them is the deprivation of liberties safeguards. This would protect people with mental illness who's in a residential home in terms of being restrained or locked in. Now this is a problem maybe for a number of homes where people may suffer from dementia and may wander and may put themselves at risk and harm. And the only way, seemingly, to stop them is to restrict them, restrict their liberties, to lock them in or strap them to a chair, I've heard examples of, or strap them to a bed, etc. But you're on dodgy ground when you do that legally by restricting people's movement in that way, liberty. Better to introduce some safeguards that give you, the worker, and the patient, for want of a better word, safeguards around doing that. And that's where the deprivation of liberty safeguards come in. And so we're recommending to government that we should look at that piece of legislation in order to bring it in Montserrat. And also in terms of special guardianship, whereby you may have an older person in the community or in a home whose mental faculties are declining, they're no longer able to make decisions in their own interests and may need to legally give that decision-making power to somebody else through the court. And that's where the special guardianship comes in. And so nobody can come in and take advantage of them to say sign over your house or sign over your assets or whatever. And it happens. We know it happens. And people need protecting from that kind of attention from others. And that's where special guardian comes in, prevents abuse and exploitation. So I think I've anticipated the legislative bit with those two, because those two are the main ones. But we also thought that a carer's allowance, let's recognize carers, and I know this is a resource that we're asking for, and that's the government's pockets are it's not finite, you know, they haven't got everlasting pockets. So in terms of paying people to look after other people, especially informal carers I'm talking about here, where people are at home providing that role, perhaps at risk to their own working life, so they may be prevented from working, earning money and paying tax, so that when they get older, they get back a pension. So they're doing that, they're giving up that to care for someone who may not be their relative, who may not be part of their family. It may be somebody who they grew up with in their community. We know that happens a lot of informal care goes on. Why not recognize them for the role that they're doing and make it easier for them? Why not have a carers perhaps register where you can capture all the carers on the island on a register? And So those kind of things we're talking about, which needs discussion, and it would need discussion from you all to say what you think, and then it will be put forward for the ministers to see whether it's affordable, whether they can do it. They may say it's a good idea, but we can't afford it. And in terms of preventing exploitation and abuse, we talked about those two pieces of legislation. We may need to strengthen other areas of legislation to protect adults from other kinds of abuse as they go about their business. Okay, I did mention briefly at the start that we need reliable, accurate information on which to base policy, and this is where research comes in. The policy itself has some, we would have liked more up-to-date information to put in here, but I couldn't find it. I don't know whether we just, we were looking in the wrong places, but we couldn't find it. So we need more accurate and reliable, up-to-date data on which to base policies. And so the main recommendation here is to establish a kind of a public health research body to do that. And it could be a branch of the statistics, it could be drawn from Ministry of Health and Social Services or any other ministry, but a few people to come together with the aim to provide research into older persons' experiences. Gerontologist is the word that captures somebody who specializes in the older person's experience, and perhaps we can, if we can, seek on someone in government or to go and train as a gerontologist to bring that information back. But if not, why not look at what we've got here to see whether people can provide us with more accurate and up-to-date data on that particular demographic in society. So we need that in order to make reliable policy. And finally, economic security, a big one. So in terms of pensions, a non-contributory pension is a non-starter in Montserrat, I believe. A lot of the Western, more economically advanced countries can afford that. And that's where the individual worker doesn't make a contribution to their pension, that the employer alone makes a pension, but they would still draw a pension when they come to pensionable age. I don't think that's viable in Montserrat. And I think the Social Security thinks in that way too. The Department of Social Security thinks that way too. But there are a number of issues in terms of pensions in Montserrat, in terms of the amount of money being paid out in pensions and the amount of money being received in from taxpayers is out of kilter. And the discussions have been started in terms of reducing that deficit and getting Montserrat back on an even keel there. And I believe that proposals have been made to government of how to resolve that deficiency, and I think they're waiting for a response on that. But that would reassure people moving into old age that they will get their pension. At the moment, I know some people are worried that we've been paying in all our life, and now I'm hearing that there's a discrepancy. Will we get our pension or not? And so, but as I said, that's going on. There's discussions ongoing about that, and I believe that it's in hand between the Social Security Fund and the government to work that out and to resolve that. We do believe, however, through this policy that there should be a review of the long-term financial implications of an aging society, because what that does, it puts pressure on the healthcare, it puts pressure on the infrastructure in terms of buildings and housing. So what plans are there, now that we know that there will be an increased demographic in terms of age and moving forward? How are we going to meet that financial obligation moving forward? So there should be some kind of long-term financial review on that. And finally, we got there, encourage learning and entrepreneurial skills in older persons. The government will, and through pension, and through social welfare take care of people to a certain degree. And by the way, what I would want to hear from you is whether you believe that the levels that those two are set at is adequate for an older person to feed themselves and meet their commitments. Is that adequate, or do we need a review of the levels of payments made out? But in terms of skills training, yes, people can help themselves. They can earn money through gaining additional skills which they can monetize. And we talked about day centers and support groups. Within those groups, within those centers, skills can be learned and could be turned into something which can earn older persons additional income from apart from their pension and the welfare. Just a brief word on the legislative process, the timeline, what we're talking about. So this this consultation runs for 4 days. Don't feel pressured that you have to submit a response within those 4 days, because it doesn't close until January. You can go online and there'll be a form specifically there for you to submit, so you can take your time, digest what you've heard tonight, and go away and write and then submit your views in that way. Why we're doing it now is because we hope to have everything settled by March, so it's got to go to Cabinet, I think. Once we've got all your feedback and incorporated it into yet another draft, then it will go to Cabinet, they would read it for approval, it would go to the Attorney General Chamber, then I think it goes to the Legislative Assembly. We want all of that done by March, and so that's the kind of timetable that we're looking at. So after that, I do urge you to read the document yourself, because you get a lot more detail than you got out of this summary. Some of you have done that, so that's good to know. So we'll get into it in a minute. But there were some key questions here that I wanted to stimulate discussion by or through. Yeah, Barbara, please join me. We will attempt to answer your questions as they come in, and please don't hold back. We can't make decisions here. In effect, we're conduits for the government. We're taking your views and we're going to pass it on to the government. So please keep your feedback constructive and helpful, and we're going to capture it and put it forward to the government. But some questions you may want to consider. What's missing from this policy? You may say that's all very well and good, but you didn't include X, you didn't include Y. Please make sure you put that in. What needs more emphasis? What needs more emphasis, do you think? Don't forget those priorities are not in order. So the priorities are not in priority order. What would you personally like to see addressed in this policy? And indeed, what issues are the most important to you about older persons in Montserratian society? We haven't really separated the genders out at all, but we know women live longer than men. Is there any way we need to or should capture that in this policy? What it boils down to really in terms of this question is, what changes do you think would improve the quality of life of people, older persons in Montserrat? That's what it boils down to. And the last two questions, in a sense, is they may be rhetorical questions, or if you want to answer them, you can. But what are your fears as you grow older? What are your fears as you grow older? And in terms of providing for yourself financially as you grow older, you may want to comment on that or not. I would say, though, that there's no judgment here, that sometimes people on a low wage, or women who have been wives for most of their lives and mothers, and the husband dies, and perhaps the husband was working all his life in the informal sector, so hasn't made contributions. Suddenly she finds herself without an income and no recourse to public funds except perhaps social welfare, because she hadn't had a career. Her life has been dedicated to raising children. And so there's no judgment here on people at all. And we know that in a low-wage economy, sometimes it's hard to even save. It's hard to even save money, to put money aside for your later years. So that may be one of your fears, the question above, that you're wondering how you're going to maintain your level of your quality of life as we move forward. So those are the questions that we just put out there for you to try to stimulate conversation. So I'm going to shut up now, as it were, and try to get your views from the floor as to your thoughts, your feelings about this older policy. Thank you very much. Agnes. The older group. You don't think that's a good idea to separate the age? I don't like the idea that you're referring to old people. Senior citizens. Okay. Right, that's a view that's been expressed before. We have Montserrat, Senior Citizens Association here. Sorry. All right. Do people have to stand up to the mic when they... Okay, no, that's a bona fide view, Agnes. We will take that on board. Yes, no. Some people... Okay. So, Kitten, Junior, and Senior. Right. True, yeah. Okay. Yes, I mean, the point well made, now be noted, Agnes. Thank you.
There are so many things that I could think of saying, but I can't remember what you first put up there.
Okay.
With regard to the pension, there are so many people in Montserrat that are working cash in hand
Right,
and not contributing to a pension at all.
right.
So how are you going to alleviate that?
Well, that's the informal sector that I talked about, and you talk about fishermen, you can talk about some farmers fall into that category.
Even contractors. I mean, if a business has been registered, and they all have to be registered, there should be some body that is checking to see that all the people being employed by that business are paying their contributions.
You're right,
And
I
paying the contributions.
I think, and then whoever knows better can correct me, I think there's a legal obligation on employers to submit for every employee to the Social Security a contribution. I think there's a legal onus on the individual also to pay. I think it's a joint one. So, but despite that, we know sometimes it doesn't happen. And so when they go to claim, the Montserrat Social Security would then say, you haven't made sufficient, and they said, but I thought. That happens quite a bit, and so they find they haven't got a pension.
Yeah, but don't wait until some poor guy is in trouble and needs, financial help. Be checking on those guys that are employing them to begin with.
Okay, yep, Social Security can do that. I think they do that. I think they do spot checks, but we're noting everything you say, so that will go forward. Yeah. Go on, Agnes.
The program that the Senior Citizens Organization has providing home care. In Ontario, Canada, where I come from, we call them personal support workers. There are private companies whose occupation is to provide the personal support workers to go into somebody's home and help that person in whatever manner is needed. They get 2 weeks training. I was one. You could go in and you can help a person with his daily bathing needs, or you can be cleaning his floors or whatever. There needs to be a proper training program for those people to know exactly what they are allowed to do and how to do it.
Right.
And Is the Senior Citizens Association doing that, or are these just people that are hired to, okay, go and help Mary with her whatever?
Okay, well, maybe the representative from the organization would have a response for you, I'm sure. Who's here?
Sorry?
The person from the... When you finish answering your questions, I'm sure Ms. Collins will respond to that. If she wants.
The seniors' residence in Montserrat that I know of, the Golden Years, Margetson, and the warden-assisted apartments up at Lookout, I probably get shot down for this. The Golden Years, I wouldn't put my dog there. I thought it was a state-of-the-art seniors residence when it was first built, and I know when my partner and I talked about moving to Montserrat, and we discussed all the what-ifs, and I said to him, well, there's Golden Years home, we can go there. And after volunteering with the Meals on Wheels program and being in the Golden Years home, it is a disgusting place. It is not a home, it's a place to dump people until they die. You go into the dining room, plastic tables, plastic picnic chairs, no pictures on the wall, nothing. A corner with brooms and mops stuck in, and on the other side is a desk that is loaded with boxes of stuff. I had to go in through one dormitory to use the bathroom. The tiles are up on the floor. It's apart from the fact that they're not wired in, the rooms are no better than the prison. Probably the prison rooms are better. It's a disgusting place. And in Margetson home, I haven't been into the rooms there, but I did witness a senior lady get reprimanded for being incognitive as she sat in her chair. That's not on.
Right. All your views are being captured here.
And in the warden-assisted apartments, I've only ever been in one. And it's pretty basic. The kitchen was so basic, it was ridiculous. But I guess the people take their own furniture in there, do they?
No.
No? That's what's provided? Well, then it's...
So that's pretty
where you're putting these people is disgusting.
Okay.
Disgusting. I'd probably say some more, but...
Well, thank you, Agnes. Maybe we might get a response regarding the...
No, I would not be responding. It's a policy meeting discussion we're having.
Okay.
So I should not be responding to what she has said. But even to what she has said, one of the first things I think in a policy that we have to get our leaders, our government leaders on, on board. And I think it was said, we are living in an age society. Many of our senior citizens, many of our population, they're aged. And as a result, our activities and our programs cannot be ad hoc. We have to get the government, all government leaders on board. They will get old too. And a lot of the things that you discussed this evening, it takes money. A lot of the things that we discussed this evening, it takes money. Our population is small, yes, I agree. And therefore, sometimes it seems difficult and maybe unimportant because the numbers are small. And so we cannot have all the services that we see elsewhere. However, I would encourage that we need to network a lot in Montserrat, that we don't duplicate this group doing that, this group. You know, I heard you mention about some health survey, and we must hire a group to do it. All that information could be had from the clinic. The government won't have enough money to go and form a committee just to get some health information. The clinics can provide us with those information. So we have to network in our program giving. But I am totally convinced that we have to convince the money people, the money spenders. They have to think planning programs, putting in their budget monies for older persons, for the activities in older persons. In Montserrat, the government does not provide medical equipment. The government does not provide medical equipment. Hardly any store in Montserrat sells medical equipment. You hardly could find wheelchairs, walkers, commodes, had not been for the Montserratians who are overseas and know that we need these things and sometimes offer them to us. And we just give them to people. But we don't go in the stores in Montserrat and find medical equipments to buy. Okay? And government does not have a home help, home care, whatever program you have. The Montserrat Senior City Association has been providing that service over the years. But the demography of Montserrat has changed. And so, in our research, we will have to say and conclude the numbers of older persons, the numbers are growing. And having a private company or an association providing that care, the money is run out. They don't have the money anymore. So government need to invest more. And of course, in the training, over the years, we have had some training for our caregivers. But of recent times, and that training used to be had through UWI. Our association used to assist them, but everybody is training for monies. So we have to get the government personnel in their budget planning to make sure they invest a lot of money in the care of older persons on island. A lot of the things that we hear this afternoon, we have been talking about them for years. We need accessible transportation. We have been saying that for a long time. Our roads should be accessible. Our buildings ought to be accessible. Getting to our buildings ought to be accessible. But here, one of the problems I find in Montserrat, we have a lot of good ideas and good things to say. But a lot of times, there's no sustainability. There's no follow-up. There's no funds put in place for us to continue these programs. And there's no monitoring, okay? If you have what you call the building committee there, the building department, physical planning, they should have people within physical planning to monitor that buildings, government buildings, they have accessible whatever in them so that people with disability and older persons could get to them. So we have to have persons not only know about these things, but make sure that they happen. And we have to therefore ensure that these people do what they're supposed to do. A lot of times we know a lot of things, but we don't. A lot of times ensure that they happen. So we need people who is going to monitor and make sure that these things are happening. The thing about monitoring the home care providers, there's a term used in the policy for it, okay? And again, we just have to know that Montserrat's population is small. We do not have competition in Montserrat for home care providers and for institutional care. We don't have any competition in that area. However, it doesn't mean that we shouldn't have standards. Right. If it's one home we should have standards. Right. I don't have a problem with that, right. Okay? But in areas where you have a lot of homes and, of course you must have standards and you have to live up to something. So, but we have to have people who will ensure that these things are done and that they are monitored. But from me this afternoon, get the government people on board and provide the means. That is so important. We can't have a policy, we don't have any money to spend for the different programs and so. So please ensure that in the minister who is responsible for persons who are aged, that some money be pumped into the policy, into the budget, so that we could have these services. And we do need them, okay? We do need them. And we can pledge our support, but if we don't have the means, right, we can hardly see and experience these activities.
You're right. Thank you for that. And let me just draw your attention on page 30 of the policy, in terms of monitoring and evaluation, we propose an advisory commission. That the only task of that advisory commission is to ensure the promotion, implementation, monitoring and evaluation of the policy. Without that, things can drift. And if things have a habit of drifting, if there's nobody, if there's no oversight. So that's as important as the policy itself is the implementation and the monitoring of it. So just to let you know, that's one of the proposals we've got in here.
Ms. Collin was right in everything she said, but we know that the government, not just this government, every successive government that's been in power in Montserrat breaks the law or ignores the laws that are already in place. And when you're talking about accessibility into buildings, they can't even build a damn toilet properly. So how would you expect them to build a 3-story building that is accessible to someone who's disabled? They have laws in place, ramps that are supposed to be put in place. Why would they put offices on the 3rd floor when someone's down here in a damn wheelchair?
Right.
Excuse my French. Just makes me so angry. Yes. And the fact that there's no lifts in place, okay, it's money that's needed, but there is no way that they cannot put the shaft for a lift on the outside of the building, because in all of these new buildings, the staircase is in the center. Put the shaft outside with the lift that goes to every floor. I should not have to crawl up a set of stairs on my hands and knees because I need to talk to somebody who's on the top floor.
Right. Okay.
And I would just like to comment, good evening, everyone.
Good evening.
If we have buildings that are not accessible, we can assist by simply putting an office on the 1st floor, meeting rooms, and persons can have the same services that are accorded to everyone until we have the monies to do what we need to do. So it's people getting creative and innovative and assist persons. Persons have come to my office and I've said, don't bring them upstairs. I will come downstairs and meet them. So it's us truly putting our heads together and being innovative and being very helpful to all the persons and persons with disability.
Mm-hmm. Thank you, Honourable Dorset Hector.
Sit down. I have read it and I'm going to write to you. Yeah. You'll be pleased to know I'm not going to give you a big long speech. But there are some issues with language and things like that, which are just nitpicking, really.
Right.
So I'll write those down. But the biggest strategic issues really are about the links to health, and some of the things that have been raised before, which nothing has happened with. And there's a lot of things in there which I've read before. It's a really, I should say first of all, it's really good. And there's a lot of similar reports that I've read over the years here, and most of them are pretty awful. But this one is really good, and so is the leisure and recreation strategy, which came out last year, I think. That's also really good. And they fit together. Because they both talk about the same things. They both talk about people staying fit and active at my age, so when I get older, I'm not such a burden on other people. And they've both got that theme in it, and they've both got the theme in about the infrastructure and designing buildings in the infrastructure and sidewalks and everything else, so it's suitable for everybody whether they're in a baby buggy or whether they actually need a frame. And that's in both of them as well. So it's 2 strategies, less than a year apart, which fit together really well, saying the same thing. But there's 2 big issues. One is the hospital. And I am concerned about Montserrat doing what it often does and becoming too obsessed with the buildings and not what they're for. And that's one of the problems with the toilet, is people forgot that was built as part of a tourism strategy to attract people to the island off cruise ships who tend to be elderly. And they thought, oh, we're building a toilet, and the building became the important thing, and the brain sort of went out the window. And I'm a bit worried about the same thing could happen with the hospital, in that the hospital is the centrepiece of the health and social care system on the island for all ages, including the ageing population. But we're focusing on the building. And we've been out to tender for the architect's drawings, and we're going out to again for the architect's drawings. But no one is talking about the system that's supporting. And if you haven't got a health and social care system designed, and which is health and which is social care, and how they fit in, and how they go from one to the other and back again, and how long someone is in hospital for, and what the arrangements are for getting them out, and then stop them going back in again. Because as we all know, people, once you get over 70, you tend to be a regular visitor at hospital, unless there is something in place to stop you being a regular visitor at hospital. So all that thing needs to be designed, and we just seem to be pressing ahead with the building. And this seems to be something that should be done, fleshed out more into health than it currently is, before we say, and that's the hospital, and that's what it's going to look like, and that's what's going to be in it. And I think this is really, really good, but it needs fleshing out a little bit to fit into the health thing. The other thing was about the welfare. And because I used to work for the Red Cross, when I was working for the Red Cross, I found a letter written by Richard Aspin to somebody in the government, I can't remember who it was, and it said, the Red Cross is no longer having anything to do with Montserrat's welfare system because it goes against all our principles, because it is deeply discriminatory, and the Red Cross can't support it anymore. Now, the Red Cross, when I was there, was supporting the welfare system, because one of the Red Cross principles is you don't just walk away because you don't like something. So we were still supporting it, but it is highly discriminatory. And most people think that's okay, and it may well be, but if you're designing a strategy for the whole of the community, then you either have to say, oh, by the way, this is discriminatory and you won't get this, but you will. Or you fix the problem. It's got to be one or the other. You can't write a strategy as if it is not discriminatory when you know it's imposed on a system that is. So I don't think you can ignore it. You either have to acknowledge it or you have to tackle it. It's one or the other. And one of the when I said there's things I've read before, one of the things I've read before was the McTavish or the McDonald review from, I've never seen the whole thing, I've just read news coverage of it. But that was from 2013, I think it says. I thought it was later than that, but it's 2013. Now, I can't even find a copy of it online, and nothing happened with it. But that said, the welfare system, the social protection system that underpins all Montserrat social care is fundamentally flawed and broken, and you need to change it. And then no one ever did. And you've raised it again, which is fantastic. But you're going to take it to Cabinet in March and say, you know that report you commissioned 8 years ago, I'd like you to do something with it now. And I'm not sure that Cabinet will be ready to have this thing revived, which a lot of them probably don't remember. And if that's central to this strategy, that the welfare system be fixed, there's I say sensitisation programme. We are all sensitised already, but I think there's other people who are outside of this sphere of interest, the politicians, maybe other PSs, maybe even the governor, who need sensitising to the fact that this is broken. We have a report that makes proposals to fix it, but we ran away from it because it meant making things that would be, doing things that would be deeply unpopular. And it's the same with the funding for the health system. We can't afford the health system that hospital is going to provide because it's going to be more than we currently get, otherwise there's no point to it. So where is the money coming from to fund the new health system, which is going to go live when the new hospital is built? And the report that I read all these reports, that's why I noticed them. But the McDonald report, McDonald report said you can't afford a healthcare system unless you charge people for it. And at the moment, I don't think there's any willingness amongst this government or any possible future government or the previous government to charge more for health. And it's discriminatory again. You get paid, you charged more depending on who you are and what your passport is and what the passport of your parents is. And so if you've got all that built into the system, then you either have to acknowledge it or fix it again. But at the moment, I don't think it would work if we set up a new health system so our older people can be looked after better, and then you create a charging system which is just everybody pays more. And I don't think that's going to work.
Right.
So they're the big strategic issues. The little bits, I'll write to you about.
Please do, and send them to us. Yeah, thank you. Agnes again.
I would like to ask the minister if someone from Treasury would come downstairs to collect my money.
I am quite sure that can be arranged, and I will speak with them.
Thank you.
You're most welcome.
Craig touched on finances. Where I come from, and I don't know what they do in the UK, but in Canada, a prescription, if my doctor gives me a prescription, based on my financial means, there is a small amount, a small fee to pay for those prescriptions. I used to pay $2 per prescription. Walter used to pay $6 per prescription based on his income.
Right.
And I'm sure that's something that Montserrat can do, because there's plenty of people that go up to the hospital for prescriptions that can afford to pay $1 or $2 per
Right.
item.
Okay. I think that's in the policy in terms of charges for older persons, whether they can be reduced or waived for that phrase that you hate.
Obviously,
For that
it
phrase
needs-
that you hate, the older old. So that's in the policy in terms of fee waiver or reduced fee at least. And prescriptions come into that. I think older persons get a reduced prescription at the moment, Barbara, don't they?
But not free. Not all
Free in some cases.
Right.
Not all old people need to have free prescriptions.
I see.
There's
Means
multi-millionaires in Montserrat that are getting free prescriptions.
sure. So it should be means tested in some way. Okay, thank you. All right, so the night is drawing in and people are having their own conversations. So, Clayton. So, okay, just a minute, unless there's any more. Go ahead.
One of the things for the policy, the method, the thing of education,
Yeah.
I think in our culture, we are a close-knit community, and in the past, relatives have helped out with the care of older persons, and if there was a cost attached, the relatives will readily jump in, all right? But things have changed, and our older parents before, they are not accustomed to paying for health care. They weren't accustomed to pay for health care. But things have changed, all right? So I think a lot of education need to be had, and to let people know that health care costs.
Right.
You may not pay for it, but somebody else has to pay for it.
Right.
All right? So some education need to be had, and some encouragement. Wherein someone could pay for his care,
Yeah.
they should be allowed to do so.
Right.
If you can't, then it would be,
You'll be held.
as it were, the government's responsibility.
Right.
But I have known in the past that people are able to pay for their care.
Yes.
They have lots of monies.
Right. So
And
those
for
who.
years, they depended on the same government.
Right.
And in the end, you know what happened, okay?
Okay.
So in cases where persons have not necessarily only money, I might have a house, okay, I may not even have children or grandchildren. And even if I have children and grandchildren, and I want to will that house for my children and grandchildren, in the time I'm alive, okay, I should be able to have some finance to upkeep myself. It's not fair to turn over your whatever to your grandchildren and your children, and government must take care of you.
Right.
Something must be done.
Right.
And government have to stop being cute
Right.
and explain to the populace that health care costs.
Right.
Another thing is important for monitoring. One good thing that will help us
Yeah.
is to always conduct surveys. You go to the new hospital, okay? And we should plan for the care before we go, you know? Do surveys. People who use the hospital, let them give their opinion. A yes and a no, you know, easy answer. And then we will plan to improve our services.
Right.
It's extremely important, the service we give to older persons,
Yes.
the manner in which we give the service. It is extremely important.
Right.
And because Montserrat population is so small, we can always, you know, communicate and think of a better way.
Yes.
We don't have to get a committee to do something. You know, we could network with Red Cross, with the older Montserrat Senior Citizen Association,
Right.
some other organization, and see how we can do this a better way and
Right.
get some of the help and the resources we need. We have to accept that we have a small population. Yet the services are necessary. But the quality of service is important. When you go to the hospital, to the homes, wherever, the quality of service is very important. And we must monitor them. And we must assess what is happening when we do our surveys and all of that. All right? And we need to educate the population.
Indeed. You raise a point that I think it's been overlooked in the policy, and that of service user feedback. I'm not sure whether that's emphasized enough, that we need to know from the people who receive the services what they think about the quality of the services they receive, and then we can feed that back and alter our provision in light of that. So thank you, Bernadine. That's been noted.
You suggested that maybe caregivers should be given an allowance. Are you referring to family caregivers?
Say again. I can't.
You suggested that caregivers be given an allowance.
Yes.
Are you referring to family member caregivers?
Well, in some instances, we'd have to there'd have to be a discussion about that. It's not just to professional carers, but there's family members who have given up aspects of their own life to care for a family member rather than and are saving the state money. So we'd have to look at whether we would need to support that person to stay in that role. Because if they didn't do it, perhaps the state would have to step in and spend money.
In Canada, I would not get paid for looking after my mother or my husband or my son if they were not well enough to look after themselves. But I would be very eligible for a nice tax rebate discount when I filed my income tax return.
Okay, all right. Well, we need to recognize that. Yeah.
I think from the policy, is it good? I think from the policy itself that what is very important is oh, you can't hear me? I think from the policy itself, what is very important is the deprivation of liberty safeguards that we are going to implement, or we're trying to implement. Because I know not only golden years, but in the hospital itself, it does happen where sometimes patients are tied down to the bed, or I've had an instance where my own relative was strapped down by 2 fingers. When I was coming from the UK, I came here on holiday and saw that they had my relative strapped by 2 fingers in the bed, by 4 fingers actually, to the bed, because he was standing up and, he was kind of confused. And so I'm just saying that it's not only in the homes, but in the hospital as well. We need to introduce that.
Fighting with the rain here. Just following on from Agnes, she prompted me about something else which I'd forgotten about really, which is the issue of unpaid carers. And the way it works in the UK is you don't get an allowance. You don't automatically get an allowance, but you are entitled to an assessment. And it's a legal obligation for the local authority to assess the carer to find out if their caring role is harming them and what support they can be given. Now that support doesn't necessarily mean money, but it can be involvement in carers groups and meeting with other people and counselling and advice. Respite sometimes is quite important as well. Now the reason I know this is, one, is because I'm a carer myself, and as a carer I have a carer's card which I can show to anybody, because it's illegal in the UK to discriminate against somebody because they are a carer on the grounds of their caring. So as a carer myself, I get a carer's card, which not only demonstrates that I'm a carer, but it also gives me discounts in all the shops. So I don't get an allowance, and if I was financially assessed, I wouldn't anyway. But all carers get recognised as a carer and acknowledged that they're a carer and provided with support. And there was, in the local authority where I lived, a carers board, which I chaired with a woman called Jadine Glitzenhern, who is actually Montserratian. And we used to spend a lot of our time chairing these meetings chatting about Montserrat. But she would always tell me how different it was in Montserrat, and she'd always say to me it would be really good if the work that she was doing as a Montserratian in the UK to promote carers, because she was a carer as well. She went back to the UK because her mother needed care. So she was caring for her mother. And she used to say to me, it would be fantastic if the work that I can do as a Montserratian in the UK, I could also do if I went back to Montserrat, to promote awareness of caring and support for caring and anything that you need. Now, in the end, her mother went into care. But until that point, she sometimes found it very difficult. And she would come along to our meetings, and sometimes she'd be in tears because she'd had a really, really bad week. But she always wanted everyone to know that carers were important, and she would never let her own personal circumstances get in the way. So it is a really, really big issue, and I'm glad it's touched on. And every country does it differently. And in the UK, you get an assessment, but that doesn't necessarily lead to anything, because it's needs-based.
All right, so I guess people have made their points. So let me ask one last time if there's any last comment people want to make. Good. So we've captured all of your comments, and we thank you. I thank you really, really sincerely for all of your comments. They've been captured. They will go together with the other comments, a lot of which have echoed the ones you've done, but you've come up with some unique ones tonight also. So we're going to put them all together, and they're going to feed into the next version of this policy so that the politicians can go and discuss it and agree what they can and can't do. So without further ado, I thank you all. Go ahead.
Just to say to those persons who are online and are commenting that we're taking notes of your comments, and we really want to thank you for participating as well.
Right. Good point. Thank you for everybody online and currently here tonight. You can hear the rain, I guess. It's beating down outside, and people have come here, giving up their time to feedback, so we thank them from the bottom of our heart. Yes, let me remind you, there's a copy of the national policy online. You can go to the government website and it will be there. There's a copy on the social services website also, and you can feedback comments to us in that way. Okay, so all that leaves for me to do is to bid you all a good night. Thank you once again for coming out, and have a pleasant night. Thank you very much. Bye-bye.